We are delighted to have you all with us. Today's session is a little bit special as it's taking place as part of a live conference on data science on HIV and AIDS research currently being held in Durban, South Africa. Allow me to very briefly introduce and warmly welcome our three speakers who will each give a presentation. Firstly, welcome Professor Tardi Reddy and Dr. Yusenta Balakrishna, both from the South African Medical Research Council, and also very welcome Professor Samuel Manda from the University of Pretoria. And we would also like to thank Leila Kodalci and Professor Ziv Schkedi from Hasselt University in Belgium for this wonderful initiative. Before we begin, let me share a few practical notes. Throughout the presentation, please feel free to submit your questions in the chat. There will be a Q&A after each presentation, so there will be time to address your questions. Secondly, kindly keep your microphone muted during the presentation, but after the Q&A, you're welcome to unmute yourself and turn on your camera if you'd like to ask your question directly to the speakers. And thirdly, this community talk is being recorded and will be shared afterwards on our website and on our YouTube channel. So without further ado, let's get started. We hope you enjoy this community talk. I'd like to give the floor to Leila.
Thank you so much, Lara, and thank you for this opportunity to organize this community talk here in Durban. So my name is Leila. I'm from Hasselt University, the Data Science Institute, and I will be moderating this session on site here, and my colleagues from Vlero US will be moderating online. I would also like to welcome the people online for joining us. And I would like to very briefly highlight this unique setup. So we have the people online, connected online via Vlero US. And for the people on site, Vlero US is a Belgian corporation for Belgium Development Corporation program for universities. And we are connecting this session with their wider community as well. And for the people online, this community talk is taking place live here in Durban, South Africa, during an HIV/AIDS conference. And this creates a really unique and very valuable opportunity to exchange ideas across continents and strengthen international collaborations and dialogue. So we are now moving into the session 2 of the program, which brings us together a series of talks on capacity building, capacity strengthening in Africa, as well as more topic-specific talks on HIV and AIDS, or about data-driven decision-making and societal engagement in the context of HIV research. So without further delay, let us begin with our very first speaker, Dr. Tardi Reddy, who will give a talk on the STEAM3 project, which is a very unique opportunity.
Thank you so much, Leila, and good afternoon, colleagues, and goeiemiddag. Unfortunately, that's the most that you'll hear from me today. Hopefully at my next talk, you'll hear a little bit more. So I'm going to share some information about a very exciting project called STEAM3D. But just before I start, I'm just going to focus on our SAMRC health and history slide. We're just trying to get the slides back. Apologies for the technical delay. We were just trying to get the slides back on. Mhm. Mhm. The screen sharing has stopped as the shared window is closed. Ah, perfect. Okay, wonderful. So I'd just like to project our SAMRC transformation statements and health and history before proceeding with the presentation. So I'm going to start by giving you a background on the STEAM 3D project and kind of contextualizing how it started, how the idea was born. I think we all recognize the need and the importance for building infectious disease modeling capacity in sub-Saharan Africa, and the very unique setting that we face. However, there are several key gaps, particularly when we look at some short-term training initiatives. Some of them may have had limited sustainability or policy translation without the direct input of taking into evidence into policy. And we've seen some excellent examples early on in the conference of cases where that did work really well, though. But regarding a skills gap as well, there may have been an absence of real-world data application within some of the courses and some of the short-term training initiatives as well. And then there have also been data limitations, the lack of data access, the absence of national health databases, and also potential complex quality of data as well that we deal with. So there was really a need to build an integrated data system as well and develop analytical and practical expertise. And this response is actually born by STEAM 3D, which focuses on sustainable multidisciplinary training with a policy focus. So this just takes you through what we propose to do, and you can see the key aspects highlighted in green. But I'm going to take you back in time, and this is about a year ago, and we've heard this mentioned a few times today about the research funding crisis and the tremendous impact that it's had. So the SAMRC was no exception, and we were quite severely impacted in terms of several of our projects as well. But at the time of notification of termination of projects, which actually commenced in February last year, it actually triggered a reframing in the way we thought about certain collaborative activities and in building partnerships and taking projects forward. It really highlighted the importance that African leaders and development organizations are encouraged to innovate and also to implement self-reliant strategies to assess local challenges, as well as the need for Africa to focus on research that's driven by local needs that can lead to practical solutions for Africa's developmental challenges. And this key shift is needed towards self-reliance and sustainable development, which is really crucial for Africa's long-term growth and stability. So at this time, which was quite a difficult time in February, we also, at the time of receiving several termination notices regarding projects, we were also alerted to an opportunity. And this was the Horizon Global Health Call, and that was via the EDCTP, via the EU. And the objectives of this call was to establish an African cohort of epidemiologists, biostatisticians, and mathematical modelers by supporting institutions in sub-Saharan Africa and Europe that provide master's training in epi and biostatistics, or those that process public health data with advanced quantitative methods. And this is part of Africa CDC's framework for public health workforce development. This is just some details regarding the scope of the call. But just to highlight regarding the training program, there were two possibilities and two angles which could have been pursued. The first was formal master's training, when we look at the training program, in epidemiology and biostatistics, or specific short-term training in infectious disease mathematical modeling. And that's the key route that we took. And you can see but further details regarding some of the aspects of the scope of the call as well. So just to take you even further back in time to SARS-CoV-2 and the SAMRC's role. So many of you may be aware that the SAMRC took on a leading role in both research as well as implementation and policy. We developed our wastewater surveillance program, as well as a real-time dashboard for visualization of wastewater and SARS-CoV-2 RNA within wastewater at several plants across the country, and it substantially expanded, started off with the Western Cape, and then there was expansion. We also led the work on excess deaths monitoring, and this was also presented on a weekly basis within the SAMRC website and led by our Burden of Disease Research Unit. We also worked on several predictive modeling, statistical modeling approaches, and I'll share a little bit of that. And the SAMRC also implemented the first vaccine rollout. So the vaccine rollout for SARS-CoV-2 within South Africa actually came via a phase 3B implementation trial, which was called the Sisonke trial. And during this time, alerted to the need for modeling and data-driven modeling response to the pandemic, it really strengthened our collaboration with UHUSLT as well as with other groups, which paved the way to STEAM 3D. This just highlights some of the statistical modeling approaches that were applied to South African data, and much of this work was collaborative work as well. And something else that played a pivotal role in the formation of this project is actually collaborative networks. So you may have noticed within the scope of the call that there would be at least one European partner, as well as other African institutions, sub-Saharan African institutions. And this is actually a key point when we looked at the collaborative networks that we had developed and how we can actually leverage these. One key network was the UHUSLT Alumni Network. So while I was doing my PhD at UHUSLT, I had met a colleague, Osvaldo Loquia, and he was from the University Eduardo Mondlane in Mozambique. And what's key here is that there's also a need to develop and to strengthen training material that's very targeted and actually language specific. So within Africa, we have several languages that are widely spoken. And if we look at those which are most common, we would, in addition to English, we have French, spoken by many countries, as well as Portuguese. And you'll see how this paves the way towards training hubs shortly. Another key network that we leveraged was the International Biometric Society, or the IBS, and specifically within the IBS, a network called SUSAN, which is the Sub-Saharan African Network. And through this, we had already established key contacts and collaboration with colleagues from Cameroon as well as Malawi. And we also had several ongoing capacity development initiatives that we had been involved in, including SACAP, as well as a newer project, SWERNAC, which is a project funded by the Gates Foundation to strengthen women's research capacity. And this is actually how our collaboration with Malawi was strengthened. So if I were to take you through in a picture, our STEAM 3D team and the project, we actually have key training hubs. We have 4 institutions. So we have the SAMRC, Douala General Hospital from Cameroon, the Universidad Eduardo Mondlane from Mozambique, the University of Malawi in Malawi, and we have our European partner, which is DSI HUSLT. And And our training hubs under the guidance as well and the leadership of the SAMRC and DSI the plan is then to expand, and you'll understand a bit more on how training can be expanded by providing these key training hubs by year 3. This is just a breakdown of the capacity and the skills of the consortium. I hope you can see that. Just to highlight that there are several SAMRC research units that are involved. You'll see 4 of those. The first is the Biostatistics Research Unit, and the skills are highlighted within. The next is the Burden of Disease Research Unit. We also have our Cochrane Research Unit, and then we also have our Health Systems Research Unit. And when we look at the Cochrane and the Health Systems Research Unit, they play quite a pivotal role in terms of knowledge translation, which is really key in terms of the driving the evidence and modeling evidence into policy decisions. And we've also highlighted the expansive expertise in our collaborative institutions, DSI, as well as Douala General Hospital and University Eduardo Mondlane and the University of Malawi, all who took on quite a pivotal role as well within the pandemic. So just to take you through some of the key objectives of STEAM 3D. So the first is to build and enhance epidemiological, statistical, and mathematical modeling skills of sub-Saharan African researchers and public health professionals. The second is to facilitate effective communication of modeling outputs to policymakers and stakeholders, enabling evidence-based decision-making. And this is for outbreak preparedness and response. And then to ensure a long-term sustainable pipeline of African researchers with modeling and biostatistics expertise, as well as to strengthen existing partnerships and build new South-South collaborations to secure this pipeline of research and development. And just looking at zooming into each of these key aims and their outcomes, we've just highlighted each of these. And a key aspect you'll note when you look at part 2 is to equip participants with the ability to translate complex model findings into actionable insights and outbreak preparedness, policy, and media engagement. And we'll outline some of the course and the course layout, but there are specific courses driven to this. So a barrier sometimes is actually the model is possibly not speaking the exact same language or communicating in the optimal way to the policymakers, and we're trying our best to bridge this gap and facilitate this. Also, when we look at the long-term sustainable pipeline, we are actually in year 1, we'll be identifying future trainers for the program from each partner institution who would then serve as future workshop trainees and e-learning developers. And they'll actually be undergoing intensive training via summer school to equip them with the skills to be able to take on and lead the training in year 3. And regarding the strengthening of existing partnerships and building new collaborations, we'll be establishing an infectious disease modeling working group. It will be hosted by the SAMRC and leverage Cochrane Africa's network, including regional hubs that already exist within Southern, Eastern, Francophone, and West Africa. And this is for shared learning, evidence translation, and sustained collaboration. Just having a quick overview of key outputs and impact. Regarding strengthening infectious disease modeling expertise, we expect to train more than 150 sub-Saharan African experts in advanced analytical tools, and also to increase the use of model-based evidence into policy. And these key outputs are interactive dashboards, policy briefs, and the engagement in task forces will be a key measure as well. And then to develop the sustainable education framework. And this is free, multilingual online platforms, as well as the regional hubs and collaborations. And what it actually means, just to return to the sustainable educational framework, is that there would be no ongoing maintenance costs. The material that's developed, and many of you will be participating on Friday in a workshop that will give you some insight into this and developing content and course material as well, is that you're able to modify these course notes as you go along. It's openly accessible. It's easily translated into various different languages as well. And it's quite powerful when we look at the sustainability of the program. And the hope is that these materials and this course will outlive us all and everyone involved within STEAM 3D, and that it will be modified and updated as time goes on. This is just a breakdown of the key work packages within STEAM 3D. So you'll note the coordination and oversight is by the EDCTP organization. And then we have program management and coordination led by the SAMRC, as well as scientific project leadership. And then we have specific work packages that are led by the various partners. So I had mentioned the Train the Trainers initiative, and that's led by DSI at UHustled. And then we have each partner and each lead of each regional training hub leading their own work package in year 3 and serving as the training hub to other countries within the Sub-Saharan African region and delivering this training. This is just the flow, the workshop flow and structure, so you know what to look forward to. So we have 2 workshops that will be hosted in South Africa at the SAMRC, and I'll break down the courses. We're using a course within workshop model. I'll break down the courses that will be covered under each shortly. So these 2 workshops will take place within the first year of the project. Within the second year of the project, there'll then be the summer school, as well as a virtual workshop that covers some advanced statistical modeling techniques relevant to pandemic preparedness. And then when we look at year 3, we have each of our regional hubs then delivering the training, which is effectively outlined here as workshop 1, and delivering that material after adaptation within year 2 to their local language, as well as to local needs and their own specific data and contextual analysis. So if I had to explain this using a map and the emergence of training hubs, in year 1, we have each partner coming through and individuals from each partner. And we have at least 30 that would be coming through in year 1 for the training and each of the 2 workshops at the SAMRC. Within year 2, I mentioned the Train the Trainers initiative, and we'll be identifying outstanding participants in year 1 who can serve as the future trainers. And there would be at least 2 identified, so 2 to 3 participants from each partner institute, who will then be undertaking the intensive summer school at Hasselt University, as well as extensive mentorship in knowledge translation and research translation via our Health Systems Research Unit and our Cochrane Research Unit. And then in year 3, we then have each training hub delivering the training on their own. And I tried to do lots of arrows, but it got too messy. But you can now imagine it. So if you look at, for example, how many French-speaking African countries we have just on the African continent, it's 20. So the Francophone Training Hub, which is Douala General Hospital, is then able to offer the training in year 3, and will be offering training in year 3 to individuals from the various Francophone countries. And it's the same when we look at Portuguese training as well. And as well as the training delivered in English, which will be led by the University of Malawi. So this is just the breakdown of our workshop flow and structure. If you're interested in how we'd be progressing and covering various courses, we've outlined the basic courses under workshop 1. You can see a key focus on establishing basic statistical expertise. The target is quite broad here. We're also targeting individuals within the public health sector and not necessarily restricted to statisticians alone. We have knowledge translation and modeling infectious diseases, part 1, and a primer on evidence to policy decision-making. The second workshop builds on skills that were gained in workshop 1, but zooms in and gets a little bit more complex. It also tackles the development of interactive user-friendly dashboards, modeling single wave of epidemics, advanced knowledge, evidence to policy decision-making as well, and as well as modeling infectious diseases, part 2. And then we have the summer school, which focuses on content and website development, and the Train the Trainer intensive workshop. And it is actually during the summer school that the development of the country-specific education programs will take place. So all those future trainers attending the summer school will actually leave having already created the content and cemented their knowledge to be able to modify as time goes on. And then we also have a virtual workshop in year 2 that focuses on a few advanced methods. One is the implication of AI and machine learning methods combined with interactive infectious disease communication, modeling multi-wave outbreaks, the use of routine health data for decision making. This will cover excess deaths, how to measure excess deaths, etc. And then we actually have a course on wastewater-based epidemiology. So there are several countries that are now collecting wastewater data and doing wastewater surveillance, but the analysis is actually quite complex. It's quite nuanced. The outcomes, the variability is extremely high. Shedding rates need to be taken into account, and it's quite a complex set of analyses as well. If I were to reflect on the key ingredients for success for STEAM 3D, one key aspect and something we've introduced is key networking sessions in year 3. So in year 3, we'll be having each training hub delivering the training via a one-week course. But we've also built in a substantial networking session that goes beyond the course participants. So it's actually to get policymakers, statisticians, epidemiologists, biologists, all in the same room and actually establish these connections. Sometimes the barrier is actually, not having this knowledge and this networking opportunity and not actually knowing who's working in which area. And this is actually to facilitate the knowledge translation. As I mentioned previously, we're looking at open teaching and learning platforms via ER Biostat. And then the local language translation. This is also quite critical when we look at the modeling to policy incorporation. We need to think about how will this be communicated, in what language, who are we trying to reach? And it also makes a substantial difference when training materials are delivered in a local language. You're able to convey certain nuances and local context as well. We'll also be setting up a data repository, and this is via data sharing agreements within the consortium that will actually enable and build a data resource to facilitate comparison. And we'll also be leveraging key networks that I mentioned previously. So in conclusion, I think you should watch the space. The project is expected to start in May and the first workshop in August. And I will end with a quote on collaboration and its power. Thank you.
Thank you, Teroli, for the presentation. Are there any questions in the audience?
No, thank you for the nice presentation, and congratulations to you and your team for getting this particular grant. And it's just a comment, it's not a question, but just to say, you speaking, I could see some contribution in terms of the session that is going to come later on the funding cuts and collaboration. I think the idea is that you are doing something that others are doing, or that can feed into others. And I think that's an important element. So I look at your workshops and can they feed into some postgraduate studies and then others are doing that. Can you feed in, for example, from one particular project to what Halima is doing within, something like that. So I think that's important. The issue of data repository, everybody is thinking about it. And so collaboratively, I think there's strength to that. So I just wanted to comment on that I think with the limited funding that we're going into, I think it's critical to see what we are doing and what we are not duplicating with what others are doing. Thank you. Yeah.
Thanks so much, Tobias. It's an excellent comment as well. And we actually aim to join forces. I think that at times like this, it actually helps to actually pool resources where possible and target it. There are many training interventions that were actually disrupted. And this could also serve, as a springboard for those, but also to carefully evaluate ongoing activities and other projects as well within the same call. And just ensure that we're isn't too much overlap, but also that there's collaboration where possible.
Thank you so much, Terry Lee. I'm Inba Naidu from HSRC. Terry, I wanted to ask what considerations were given to training in AI, if any. Thanks.
So we've actually included one specific course on the implementation of AI and machine learning methods combined with interactive infectious disease communication. It will take place in year 2 after the core foundation is built in year 1.
I just want to continue something, the idea of Tobias. It's not just that other people will be able to use it. It's very important to report on the output that produced by this project. Let's say in Susan or IBC, that other people will know what actually is available. That not just that we develop something, but that everybody know that this is now available and can be used in other programs. Because that will save a lot of time and a lot of effort for other people.
Thank you so much for all the questions. And in the interest of time, I'm going to thank Terry Lee once again for her talk and welcome Dr. Yusanta Balakrishna for her talk as well.
Good afternoon, everyone. So today I'll be speaking to you about investigating sexual behavior clusters and their association with HIV prevalence using national survey data. So sexual behavior is dynamic and multidimensional, and it's shaped by a range of biological, social, and contextual factors. In populations with a high HIV prevalence, such as South Africa, it is particularly important to identify distinct behavioral profiles that may signal increased risk. By analyzing patterns across key behavioral indicators, we could uncover hidden subgroups that help to explain the heterogeneity in HIV vulnerability. So several studies in South Africa have been investigating sexual behavior, and they cover a wide range of variables. They look at individual level demographic variables such as age, gender, and education, sexual behavior variables such as multiple sexual partnerships, condom use. They also look at psychosocial and cognitive factors such as perceived HIV susceptibility and attitudes, as well as community level variables such as neighborhood ethnic composition and community poverty levels. Health-related variables are also covered, such as STI history and HIV knowledge, as well as geographic factors like the province of residence and urban versus rural location. So one source of data in South Africa that contains many of these variables is the SAPSIM survey series. So the SAPSM surveys are a series of nationally representative surveys conducted periodically in South Africa to assess the prevalence, incidence, behaviors, and communication related to HIV and AIDS. It's conducted by the Human Sciences Research Council using a cross-sectional population-based household survey design with multi-stage stratified cluster random sampling. The survey population consists of persons of all ages living in South Africa at the time of the survey, and all members of the selected households were invited to participate. So the survey was carried out since 2002, and in the study we have focused on the survey years of 2017 and 2022. So despite this comprehensive national data source, much of the peer-reviewed literature still covers determinants of single outcomes, such as determinants of focusing on multiple sexual partnerships or age-disparate sexual relationships, HIV testing, and early sexual debut. But there is value in evaluating multidimensional classes. So this presents an opportunity to investigate the application of clustering methodologies to uncover comprehensive behavioral patterns. Our aim is to apply clustering methodology to sexual behavior variables to identify different subgroups in the population. Furthermore, we are interested in evaluating the changes in these subgroups over the survey years of 2017 and 2022. So in our data, we looked at several sexual behavior variables, and this was restricted to those 15 years and older and who reported sexual intercourse in the last 12 months. We looked at the age at sexual debut, age-disparate sexual relationships, having more than one sexual partner in the last year, condom use at last sex act, and consistency of condom use with the most recent partner. We looked at the recency of HIV testing, as well as HIV risk perception. We also looked at transactional sex. And for females, we considered recent pregnancies. And for males, we looked at circumcision. So for our methods to identify the latent groupings within the categorical survey data, we employed a two-step approach combining multiple correspondence analysis with partitioning around medoids clustering. So the dimension reduction properties of MCA are used to transform the high-dimensional categorical data into low-dimensional continuous space, which is suitable for clustering algorithms such as PAM that require a distance matrix as input. So just briefly about MCA. So MCA identifies the principal dimensions or factors that capture the most significant variance in the relationships between categorical variables. It transforms the categorical data into a numerical representation, producing a set of factors that give the scores for each data point. So these scores reflect the position of each observation within the reduced dimensional space. So by projecting the categorical data onto a continuous space, MCA enables the application of clustering methods designed for metric data such as PAM. So looking at PAM, it's also known as K-medoids, and it uses actual data points as the cluster centers called medoids, as opposed to K-means clustering, which uses an average of the cluster as the cluster center. So the medoid is defined as the observation in a cluster with the minimum sum of the similarities to all other observations within the same cluster. And it's the observation with the best representation of the cluster. So all possible combinations in the given data set are tested, and therefore only one solution is possible. PAM, unlike K-means, does not assume spherical clusters and performs better in identifying asymmetric, noise-resistant group structures, which has advantages in survey data. So for our methods, all analyses was conducted in R, and we stratified by gender. So first applying MCA and then PAM separately to males and females. We considered two approaches. We applied the MCA and PAM separately to the 2017 and 2022 data. And in our second approach, we combined the 2017 and 2022 data. So applying it separately, we would be able to evaluate changes in the characteristics and the number of clusters. And when applying it to the combined data sets, we are able to evaluate changes in the cluster sizes. So currently, the work that I'll be presenting today is based on the unweighted data, and we are in the process of adding weights to the data. So we retain the number of dimensions that accounted for at least 60% of the data, and the number of clusters was selected using silhouette analysis while also considering interpretability. And each cluster was profiled based on its distribution of the original categorical variables. So looking at our analysis, so on the left, we have the results for the males, and on the right, we have the results for the females. So the points that you see here represent individuals in the data set, and we overlaid the clusters that we found from PAM over these individuals. And you'll see that this is plotted for the first 2 dimensions of the MCA. So we did retain 8 dimensions. So if you plotted on looking at, for example, dimensions 3 and 4, the placement of the clusters will change. So looking at the results for males 2022, we found 5 clusters. And looking at the distribution of the categorical variables, we could characterize each of these clusters. So for the first cluster, we found inconsistent condom usage, multiple partners, a large proportion with transactional sex, many never tested, and a high risk perception. And using this, we characterize them as the risky behaviors group. For our second cluster, we identified a high proportion of later sexual debut with low condom usage, a high proportion with partners at least 5 years younger, and low HIV risk perception. And this was classified as those in stable relationships with recent testing. For our third cluster, we found a large proportion of those with, that were already HIV positive and having their last HIV test more than 3 years ago. They also had reported having a partner at least 5 years younger with inconsistent condom usage. And this was classified as people living with HIV. Our fourth cluster was characterized as a protective behaviors group. There's a high proportion of sexual debut between 15 to 19 years, consistent condom usage, low HIV risk perception, and a high proportion of circumcision. And in our fifth cluster, this group exhibited the same characteristics as cluster 2, but with testing between 1 and 3 years. And so this was characterized as stable relationships, but with less recent testing. So looking at the variables that were not used in the clustering, but associated with later. So we see for the risky group, we have, okay, so as expected, the highest HIV reactive status was amongst those people living with HIV. But excluding those groups, we see that there's a high proportion amongst those that were considered to be in a stable relationship, but with less recent testing, as well as those that were considered to be in the risky behaviors group. Looking at the age, we see that people living with HIV tended to be older, 43.2 years, and those in the protective group tended to be younger, 28.7 years. We also looked at their living arrangements. So the risky behaviors group and the protective group were mostly single, whereas in the stable recent testing group and people living with HIV group, there was a larger proportion living with their marriage partner. Looking at the response rate, so these are people that provided a blood sample for the survey. This was highest amongst the people living with HIV and lowest amongst those exhibiting protective behaviors. Looking at the province results, so we see that, for example, the Northern Cape had the highest proportion that contributed to the risky group, and this aligns with the provincial results that we see from SAPSA. So looking at our results for the females of 2022, so we found 5 clusters amongst females. The first cluster was characterized as those in stable relationships with recent pregnancies. And there was a large proportion with current or recent pregnancies, later sexual debut, low condom usage, recent HIV testing, and low HIV risk perceptions. Our second cluster, we characterize as the protective behaviors group. So these participants exhibited consistent condom use, recent HIV testing, low HIV risk perception, low recent pregnancy, but they did have the highest proportion of multiple partners. So there is a high partner turnover in this group. Looking at the third cluster, this was characterized as participants with risky behaviors or less stable relationships group. They exhibited early sexual debut, low condom use, partner at least 5 years older, and less recent HIV testing, as well as a high HIV risk perception. In our fourth cluster, this was characterized as the risk-aware group with recent pregnancies. And they exhibited characteristics such as inconsistent condom use, a partner being at least 5 years older, a recent HIV testing, high HIV risk perception, and recent pregnancy. And finally, we had our fifth cluster, which was characterized as people living with HIV, as they had a high proportion of already HIV positive with the last HIV test more than 3 years ago. They also had characteristics of a partner at least 5 years older and inconsistent condom usage. So looking at other variables in association with the clusters that we found, we did see that the oldest people living with HIV, participants tended to be older, 37.2 years, and the protective and risk-aware and recent pregnancy groups tended to be younger. Looking at the reactive HIV status, obviously higher amongst the people living with HIV, but looking at the other groups, it was highest in those characterized as being risky or in less stable relationships. The people living with HIV groups and the protective groups tended to be single, whereas the stable and recent pregnancy groups and risky or less stable groups tended to be living with a marriage partner. Looking at the response rate, this was very similar to what we saw for males, the highest response rate coming from those living with HIV, and the lowest response rate coming from those classified as being in the protective behaviors group. So looking at the cluster size changes between 2017 and 2022. So we see that the risky behaviors group, it consisted of 35.1% of the sample in 2017, whereas in 2022 it consisted of 24.6%. We see that protective behaviors group also decreased from 26% to 16.9%. And there was an increase in stable relationships with recent testing and stable relationships with less recent testing. And one of the biggest increases were in people living with HIV, so going from 6% to 16.1%. If we look at the results from our analysis of looking at separate, the years of 2017 separately from 2022, in the 2017 data, we only see 2 clusters coming through, which is risky behaviors and protective behaviors. Whereas in 2022, we see the stable relationships clusters and the people living with HIV clusters coming through. And this aligns with the increase we're seeing from the combined analysis. So that increase in people living with HIV moving from 6% to 16.1%. And this aligns with the aging HIV epidemic that we're seeing. Looking at the changes in clusters between 2017 and 2022 for females, we see that the stable relationships with recent pregnancies decreased from 34.5% to 26.4%. Protective behaviors increased from 26.4% to 20.1%. Risky behaviors and risk aware stayed relatively the same. And people living with HIV, similar pattern to what we saw for males, increased from 0.8% to 15.5%. So in summary, the people living with HIV pattern was stronger among both males and females in 2022 compared to 2017, and consisted of older males and females, which are both characteristics reflecting the aging HIV epidemic. The risky behaviors pattern had a relatively higher HIV reactive status compared to other patterns and consisted of younger males and females. In a study that had the same objectives to ours, they used LCA and identified 3 sexual behavior classes across genders using SA population-based survey data. And they found 3 clusters. So single with consistent protective behaviors, the second cluster being risky behaviors, and the third cluster being in union with lack of protective behaviors. So we have also identified these patterns, but with the inclusion of people living with HIV. And from our preliminary analysis, we can see that the sexual behavior patterns may be more complex for females than for males. So this work is not without limitations, and our ongoing work aims to address these. So the results presented today are based on unweighted data. However, we are currently incorporating the survey design and weighting into analysis. And from initial results, cluster characterizations are quite similar when including weights. We are also going to be looking at different clustering algorithms, including LCA. So at the moment, our LCA analysis is suffering from model convergence. So that is something we need to explore. And we also aim to explore the cluster evolution analytics framework for formal testing of the temporal changes between clusters. So we're interested in changes in the number of clusters, changes in the cluster characteristics, and the between cluster migration of objects. So overall, these findings illustrate how clustering can move beyond single indicator analyses to better capture behavioral complexity, enabling the targeting and tailoring of HIV prevention programs. Thank you so much for your attention.
Thank you so much for the very interesting talk. If there are any questions online, please don't hesitate to unmute yourself. And if there are questions in the audience, I'm on my way. But for the people online,
thanks, I think, for the talk. Either a question or just comment. I just wanted to know, in terms of the naming of the groups, those 1, 2, 3, 4, 5, was that informed by you or the team who are working in that, that area of the HIV? So that's one question or a comment. Then, so you have, say, 5 factors, not 5 factors, 5 groups that have come from LCA, and then you have got some percentages of gender in each of those groups, of the provinces in each of the groups. I think maybe as an added thing that you can do is to fit some sort of, let's say what, a multinomial regression, because that will give you a bit more power. Then you can actually mix those two gender, male and females, and do some sort of what, interaction term to see which one would interact with gender, other than to look at one. Yeah, so that things.
Okay, thank you so much. Yes, so for the first question on the naming of the group. So at the moment, it's just based on what we're seeing in literature. But we're definitely going to be, so our team definitely needs to expand. And we are going to be incorporating people who have expertise in this area with the naming as well. So the project is definitely in the early stages. In terms of the modeling, yes, that is definitely on our radar. So as you work through the analysis, you realize how much there is to do. And it's definitely, I feel, really grown into all the areas you can explore. So we're definitely keen on bringing in more hands, especially to help. But modeling is definitely in the process.
Great presentation, Sandra. I just want to ask, maybe you have said this, maybe I may have missed it. Given the fact that you are mostly relying on sexual behavior, how do you account for the differences really in the actual HIV risk, given that the same behavior may give you different outcomes between individuals?
Okay, so at the moment, we're choosing just to focus on the sexual behavior variables, but there definitely needs to be work done to determine whether these are all the variables that need to be included, or whether more need to be added. Once we've determined the variables that need to be included, there needs to be some sort of sensitivity testing to test the stability of our clusters. We need to make sure that the cluster characterizations don't change with any transformations in the data. So whether you remove some participants, do you still see those same clusters? If you add some, do the clusters change or remain the same? So we do need to validate our clusters in terms of stability as well.
Thank you very much, David. And what I want to say is, it looks like didn't hear you talking of whether the clusters are distinct. It looks like you treated them as separate, but I would like to be interested in whether there is some kind of dependence. And since you are just looking over time, as do the clusters remain the same just over a course of time? Can somebody move from one cluster to another? Because you're talking of the risky sexual behaviors or the sexual behaviors, people tend to change their behavior over a course of time. I would like to see you capturing that. I didn't hear you talking about that. Is you assumed that they are independent. Every cluster is independent of each other. And I could, it would be interesting to see if there is an effect, like the multi-level effect, if the clustering is affecting, and what is the effect without clustering, and when you consider clustering, what will be the other effect that you may see there?
Thank you so much for the suggestion. That is definitely something that we're thinking about. So at the moment, yes, our clustering method is using like hard clustering. So individuals are separated just into one cluster. But from the results that we're seeing, we're also considering using like soft clustering or fuzzy clustering, where individuals can belong to more than one cluster, but to a certain probability. So they exhibit different probabilities of different behavioral patterns. So I think that is something that we're looking to explore going forward as well.
We will go for the last question for Lucinda.
Thank you. Thanks for the presentation. Yeah, I'm just curious on the distribution of participants in the different surveys for the different clusters or groups. like 2017 to 2022. I think it was the HIV, people living with HIV group that had 6% in 2017. And all of a sudden it's now 26%. So I was just wondering whether it's a true reflection of, you know, the MCA clustering, you know, result, or it's an issue about the survey design, probably, which then sampled a different population, probably. Yeah, so just, yeah, I don't know your explanation on that. Yeah.
Yes, no, thank you so much. So definitely, so firstly, so it is unweighted data. So we will need to evaluate the percentages once incorporating the survey design and weighting into it. Secondly, I think it comes back to the question of stability as well. So whether if you change certain decisions in your algorithm, whether the cluster sizes actually change. And also in terms of the changes that we're seeing, I think it's, for example, I don't think it's that like risky, for example, risky behaviors are necessarily increasing or decreasing. It's more like people are exhibiting more risky behavior patterns or more stable relationship patterns. So I think it's about the extent of the behaviors that they're exhibiting, not that they're necessarily moving from a stable relationship to like a risky relationship situation. But there's so much more parameters that need to be investigated. So I definitely wouldn't say this is the truth at the moment until further analysis is done to ensure the stability and validity of the clusters and to ensure that so we looked at two different approaches, like separately 2017 and 2022 and also combined. So we do need to ensure that the results that we're putting out make statistical and methodological sense as well.
Okay, thank you so much, Jacinta. And let's have another round of applause for Jacinta. And welcome Professor Samuel Manda for his talk on Global Index for Volunteer Engagement.
Oh, that's fine. Yeah. So, yeah, I think Ziff, when he was asking me, I didn't know that I would talk for 30 minutes. But I think I would talk over that. So this work, it is in a work that I am doing with UN or here it's called UNV. And it's since 2024, and we had phase one of coming up with a tool to measure volunteering. Then again, phase two, which we are yet to, in terms of the budgets, would now focus on the implementation of the tool. So yeah, so this is all about phase one, what was done and how did it come about, and then I mean, some people who were part of the team. So I'm going to cover. I think most people have got no idea on the scale of what we call volunteering. Even me, I didn't know until I was contacted by the UN to say, can you be part of the team to work on this role on how to measure volunteering. So I didn't know in what they meant, but obviously I went on the website, I read a lot about it. Then I saw how big it is, that they even have a UN body only for volunteering. And again, even the African Union have got a big office in Addis Ababa only for volunteering. Then obviously, as you are getting involved, you would learn a lot. They even have what offices in SA, in Zimbabwe, in Zambia, in Kenya, in Senegal, in Jamaica. So I said, this is very huge. So in here, I'm going to talk about the work that I'm involved and some of the UN things about volunteering. So, and then I would feed into the work that I'm doing. How does it feed in some things that are coming from the UN, not from the UN, from the African Union, from the UN, and from some people who are in charge of volunteering at the African Union. So, yeah. So this is, so if you think about volunteering, it is really in so many places. In here, we have a big team here in SA. Whenever there are floods, say what, let's say in Mozambique, there's this group, I think it's called Givers of God or God Givers. What again the name? Yes, Gift of the Givers. Those ones, they will be in the news to say they were the first people to go there. Those people are the volunteers. Then if you go into crisis or there is some wars, you would have those guys called Borders Without Borders. Sorry. Doctors Without Borders. And they will be there. Those people are the volunteers. And there are many volunteers in terms of animal welfare. I saw them there at this park, at the Kruger. They were there just to look at the animals that were being attacked or whatever, to put in some gel there. Those people are the volunteers. Then you would go to the old homes, you would go there to sweep or to clean, you would even cook for them. That is volunteering. So volunteering has got a terminology which is under UN. It's there in, obviously it is not in blue, but it is in black and white. It is any work you do where you do not expect any salary. So, but you can get some money because you need to eat or you need to buy soap. But it's not a salaried thing. And it must be done to people who are not in your family. So if I go and I babysit, which I always do, maybe the child of my niece for 6 hours, I am in there, I am not volunteering. That is by ILO. And it must be that. So, but if I do it, let's say if everybody has got a child, says, "Sam, can you become a child? I want to go to the party." Then I'm there for 2 hours. Then I am volunteering. You see now, it is a simple difference, but a bit confusing. So, then, because there's so much work people do under volunteering, and especially where it is formal. Formal, it means I go to a school, I go to a church, I do the cleaning. If they had hired labor, then they could pay money to that person. But me, I am going there with my car, I just go there. And maybe for 2 hours, I just clean. I don't get any pay. Maybe I might bring some water for me. Because now the cost that they would have saved, that money that they would have saved, And it's not only one person, there are thousands on earth. That money, it is not reflected in the economies of the countries. And then because of that, then there's no data as well. I mean, data is there, but mainly in France, UK, and in Spain and the countries, these are there in automated, but in Africa, it is near zero. So because of that, the UN system thought it wise to make noise about volunteering. And this is not something new. It has been there way back. But I think in the last few years, they thought to actually do something. So to do something, now they had to come up with, we need to have an index that would measure volunteering. Then in the report, because UN have got, they have reports every year. So you can have a report from UN about poverty. It's there, MPI. It is there every year. Then again from UN, you would have a report of the HDI, Human Index of Development. There are so many reports from UN. There's gender inequality, there's so many things. Then even UN has a report on volunteering, and that comes out every 3-4 years. And the one that came out now, it is only on how to measure, where to measure, whom to measure. So I'm going to reflect on that report. Then what has come up from the African Union, again, in their own report, then look at how, where I fit in as part of that. So, so here I'm talking about, the challenges, about how to measure. So in fact, here I would have said it, that most people, this one here, please can you show me? That's better. So, because most of volunteer work which we do on a daily basis, it is informal. It means I don't need to go to help out at a church or at city of, let's say at Chwane city or here at the city, but I can do it within my community, where I would go to help out cook food if there's a funeral. So that is measured, and it is done on a daily basis, or whatever you can call it. Then if you do a survey, you find that almost everyone would say, I do volunteer. If you ask them to say, have you done any work out of your family in the last year? I tell you, if you go to my village, everyone will say yes. Because they have gone to attend funerals and they were cooking there. Some men or boys, they would go to dig a graveyard. So all those are a part and parcel of that one. Yeah. So here now is the report. So this report is called the State of the World Volunteer Report. So for the 2026, that's where it came out. So the work of UNV, they had a team. So that team was being coordinated by Marty and Bianca from the University of Northumbria, and then I was part of the team in a sense that I was tasked to come up with a chapter that would come up with an index. And the report was launched at the UN on the 5th of December as part of assembly. So now the report of 2026, which is available online, it is about volunteering and how to measure it. So now this report has got about 8 chapters, So chapter 1 is a scene, chapter 2, some of the examples, chapter 3, then chapter 7, it is about give, the index. So that's what I will talk about. And so then what is the index? What does it do? I think before 2024, in the last certain years, from maybe 2018, 2017, there was a challenge that in work that is about volunteering was under-researched, undervalued, undermeasured. And so that is now the context. Then, I mean, of course, I must claim. So then when they decided to come up with an index, that time it didn't have a name, but they said, Sam, can you come up with a proposal? And then from there, we will find something, but come up proposal on how to construct an index for volunteering. And I do remember that I briefly talked to Tobias, and I think he is going to remember if he's here. Is he gone? Yeah, he's there. So he doesn't remember because now it has got some effects on his advice on why I stepped out of being an HOD at UP. So in the past, before the index, what was counted was the number of hours people put in and the number of people who would volunteer. Then those people who are experts in this work, coming from psychological, coming from sociology, they said it is more than that. It is the actual impact on people who volunteer, not about money or about the time. So we will need to take all those ones into an index. So that's what so now. So the index that has been developed, it does go over the actual numbers. It is complex and again multidimensional as any other index that we know from the UN. And then the index now is a tool that you can compare the value of volunteering between countries, within countries. So that is what we want to do. And why now? So always people are asking before, no, not now. Now I am now an expert now. But in the first few months, I was getting lost. Why now? Why now? So I said, oh, okay, guy, please, can you ask UN? Then afterwards, I became aware of why now. So why now is because we want to look at the SDGs. So if you look at the SDGs, there's so much work people do in terms of volunteering. If you go to help out at an old school, you are teaching, you are trying to help in terms of SDG, maybe 3 or 4. If you go to the old homes, you are helping out in the SDG 2, I think. Then if you go to the animal camps, you are helping there to clean animals, you are supporting SDG, maybe 9 or 8. So that's one thing. Then again, we saw under COVID that there were many people who would volunteer. I saw them, so many. Then it becomes. Then again, we have got so much data, I think from surveys, then we do that. So now, when we measure things, so if you don't measure anything, it is not seen, it is not even counted, it doesn't have any value. So that is the theme. You measure, it counts. So that's what we are looking there. And then UN has designed 2026 as the International Year of Volunteering. So this is not me or or your father or my uncle. It is the UN where every member state, they went there to UN and they voted for this one. Obviously, others were sleeping, but it came out as a vote to say we will need to do that. So you see, so now there is a big momentum from UN about volunteering. So those ones, and there's a lot of how to mentor youth. I think everyone would say, I do mentor youth, I do mentor youth. So, and then there is local efforts, and we have got when you respond to those ones. So this is the core is we must celebrate people who do volunteer work. Others, they die. I mean, if you go to Sudan and then it's not Sudan, but if you go to war zones, people there are shot. I mean, we have seen news, not news, whether BBC or Sky News or I don't know, in that place called Gaza, people there have been killed because they went to volunteer to help children. So it is a risky job, but people go there to volunteer. And so this is now the UN stuff. I just want to put it there. So it is not I think, something that is coming out of the window. So then, in what, on the 5th of December 2025, the whole report was launched at the UN. I didn't go. Then, but now the IVY 26 team had a side meeting. So I was part of that meeting, coming from South Africa, but on Zoom. So in fact, I am quite happy that you see this team here. It is, you see now there. You see, I was talking with Zuma there to say what's happening. So I said, no, at least I am putting UP on the map there. I see UP is there. So that logo was seen by even people in Mongolia. I mean, because it was under UN. So this is the launch of this report, and then I was one of the speakers because I was speaking about GIVE. So then what is GIVE? So GIVE, this is what I would do. I mean, I would always use now. Wherever I go, people ask me, can talk about GIVE. So here's GIVE. GIVE now, it does now look in terms of the impact over simple numbers. And this is the gap that it is addressing. And it complements other well-known UN indices. I mean, everyone here knows about this one, this HDI. HDI is a simple index. It has got health, education, and then poverty. These three, every country on earth, they will take those three from any sources and put it in HDI and put it in this big map. And I have seen some people very angry. Why am I low there? But now you did not argue when they were taking what data. You argue afterwards. Then, so how did it happen? So we had so many workshops. I've never attended workshops where I am not even talking about statistics. So we had so many workshops in Africa, in Asia, in Europe, in South America, only about what should go into this index. What are the indicators? And some countries, they don't want you to talk anything about religion, because they said in here, if you talk about religion, it means everyone now will volunteer, because that is part and parcel of us. And some countries have got 100% volunteering. I don't want to mention their names because by force, they must volunteer. So if you are forced to volunteer or you are coerced to volunteer, it doesn't count about the volunteering. It must be on your free will. So if I say you can come here to volunteer, then later I can give you money to go home. That's not volunteering because there's a bet for it. So it must be on a free will. So this is what so now after going through all those things, going up and down, so that will be from end 2024 up to the middle of some month there, month of last year, maybe May, June. We came up with so many indicators, so many dimensions. Then we had to narrow them so that they're a bit common. And then that's where now I was doing the work as a statistician. So we how to aggregate. We did lots of aggregation methods. Some data was simulated. Whether it is equal-weighting coming from PCA, coming from FCA, all those things. And then you test if ever they're robust. Then from there you would come up maybe with something simple. So now here are these are our first 4 dimensions. Because it is an evolving index, it would grow as time goes on. Maybe other people would do research in the future. But as a start, we said, can we have something that is easy to understand? So this one here. So these are the indicators. So these are at the level of an individual and at the level of the community, at the impact on the community. These will be coming from government. So if they've got laws about volunteering, which is very good because now you'll be protected from abuse. Then obviously this is in a big report. So in the report there, I had written how many of these in one can use as a minimum. Then from there, this is not hard. It's very easy because those people who are experts, they would tell you what they want. Wherever you go, whether you go to Jamaica, you go to Chile, they'll tell you. Then this is where things now become a bit harder. So to find data, that is a big issue. So this is the issue that we are going to actually battle in the next phase, because in the next phase, we will need to come up with a report, maybe for at least 80 countries. Then how to get it? But that's not it's an issue, but it's not an issue that can be done. So that's why we are in this project. Then from there, once you have this data, then you can compute each of these ones. Then later you would have them that one. So some countries would score higher here and here low or higher here, but when you combine, maybe they'll be in the middle. So all these ones. So these ones, it is on the same setup as any other index. You would have dimensions. Each of those ones would have their own indicators. Then you have them to combine them in some sort of a manner to get an overall index. So now, what is coming up in the future? We are going to this one now. So we are going now to collect data because in phase 1, we just did a review of what is available, but that was not what extensive. What we did was we just said, let's look at this. But now we would actually get the data now and compare the data. So it will be so much work because how do you now harmonize the responses? Some of them they would say in the last 3 months, others will say in the last 8 months, others will say in the last 2 weeks. But how do you now do that one? So this is what we are going to do here. We are going to get data, compile, and look assessment. Then we will do the index computation. That's a long process because now, so in short, the index, that's done. It is now under UN system that is owned by UN. It is now out of me now. So it is now under UN. So that's now what a public thing. It is not me now. So then he obviously would have things to, things. I think things to validate. I think the center said she's still on the way to validate, the naming. That's there. I think Lee Johnson has done so much work on Tembisa, but he had to go as well through this process, whether things that are coming out of the SMS they make sense. So Lee had to get people to come to this, to whatever they went to say whether things work. So then we are going to have all these reports, those ones for regional reports, some of them up to global reports. And then once we meaning we now, I'm talking about UN. Once we have done this, then it will be a fully fledged index under UN system. Then people now can argue about it. They can adapt it to their settings, just the way people have added some indicators to the HDI, to the MPI. Some countries are using only 5 indicators. South Africa is using 12 indicators. Zambia will be using 6 indicators, but they all will say it is under this thing called MPI. So that's what we do. And then so in here we are here. So we want to have you. Then this is where UN would need to integrate GIVE into this one. Then we would have the different support. So I am here, but I'll be talking to these guys, this guy there. Last week I was in Zimbabwe. There I was meeting these people here, and this is our effort. So that's needed as part of this is part of the UN system, and so this I think Leila, please can tell me how far. Oh, that's good. So here this is now the report of African Union 2025. I looked at it. It is here. You see, it's so in Africa, on average, we are nearest. So 6 out of 10 people in Africa we do volunteer based on the meaning of ILO, not meaning of your village. So that's there. And it is many youth under 35. And funny enough, it's not funny, sorry. Good enough, men and women were equally involved in Africa. And these are the number of the actual hours. This is the money that has been replaced or gained, by where we went. And so if anybody who is a volunteer were to form your own country on Mars, you would be so very rich, be very rich. But of course, if you have got a country, maybe you want even volunteer. So, but anyhow, then we have got things that we know. So, like South Africa, we say Ubuntu. That is what we do always. Of course, I have seen it in many places. Ubuntu here in Kenya, we've got this. This is good news for Kenya, but Anne is here. Sorry, Anne and Peter are here. So guys, I don't want to make it. But these were used by that guy called Jomo Kenyatta, Harambee, and Peter was saying Harambee back to him, and obviously it was a bit abused as well. Then if you go to Rwanda, they say Umuganda. Then this is in Ethiopia, in Morocco, in Botswana. In fact, I wonder if we have anything in Malawi. Halima, do you have any Malawi? I think Malawians, we are very sad. Huh? I mean, we can't even have a word to volunteer. So maybe singing, a word. No word. Please, guys, can you find a word for us? Maybe, let's say what, kupeleka, maybe, to give. Yeah, let's have it. Kupeleka. You and me, then we can start. So then, anyhow, most volunteer in Africa, it is outside formal. So formal, it means you are part of that thing called God givers, food, or whatever it's called. Yeah. And then so, African Union had a very good at coming up with names of things. So African Union, I don't know who was drunk. They said we are going to, now we have got 7 aspirations. It's there in the books of African Union. So obviously, because they came up, then as we found a way to say, how do we fit in? So our work, it fits in all these ones. That's enough from African Union. Then now, how do we transit from the African report to give? So, this report of African Union says what? So the word from African Union report, it looks at the scope and the scale. Then give says how to capture that. And then this is a blog of this guy, Dr. Machecha Cherelaga. The guy sounds more like from Zimbabwe. Is it true, maybe, guys? No? Yeah, but anyhow, it doesn't matter. He's from Africa, but he's based he's here, African Union. So this is what he put in his blog, because he was trying to comment on the SWVR 2026 and the GIVE report. So this is what he was talking about. So here you say here, it is not just a statistic. It is how we, people from Africa, that's our life. We would always help out. And some people would really abuse, they will say it's free labor. So I think now that you have known about the work of people who do volunteering, it is never free labor. People volunteer because they have got a heart to volunteer. Of course, people who are young, they would want to gain skills. That is impact on them. People who are very old, and soon I am there. I'm going to volunteer more when I go there, when I am at that age, because I want to have friends, because I want to have Peter or Singini, or no, but Peter and I, we are going to be there together. Then now we will go to volunteer so that we can make new friends at our old age. So there's some people volunteer to make friends, but it is in the certain age groups. So then it is not about free labor. That's what I want to say. It's not about free labor. So we must move. We must make ourselves move from that to that one. And then so here things, we must make it official. It must protect people, count the impact, not the numbers of people who volunteer, but the numbers. But here I am talking about on Africa, but there's a similar report is in Asia, a similar report is in Europe, in South America. So there are 6 reports. But I can't talk about those reports because now I am here. If I go to Asia, which I will do, I am going to edit this and put it what they're saying. And so then here, this is we need from. So this is what it is. It's coming out. So this is so he says, this guy from African Union, that we must move away and go there. So based on the GIVE, these are what we have proposed and what they measure. So that's there. And so we have now, we have got this, coming from the SWVR, coming from the IVY 2026, and we must make it official, protect the people. But this is what GIVE says. Count impact, and count the impact. It is exactly what GIVE is doing. And so we have got this one, 2226, and this was adopted there. And then how do we feed into IVY? Give feed these ones? No, these ones adapt. This is what I will give. I give to the African Union, to the UN. There's this UN body of big guys, policies, who were ministers in their own countries. Now they will come to the meeting. Then they say, where is that boy of give? Then me, I will come from somewhere in my suit and tie and talk about these things. And they say, oh, that's good. After a bit of some wine, so that's what we do. So anyhow, so this is what it does give, and the give provides data backbone to track progress, demonstrate impact, and justify investment in frontier. And so all this one. So this is something coming from this lady who is the country. So then she looked at the give, then she took that one there. And so what we have here, so this is what we have. So we have got evidence that the people who volunteer, they have got so much impact, but we don't measure it. And the tools exist, and that tool is now the give. And there's this one, the IVI, now it's up to us, meaning us, yeah. So yes, yeah. So we would make this one, and let's count what counts. So this is the team. I was picked there. Then I picked some people to help me out, and this guy is the chief volunteer, who is my boss. If I look at the other arm, and then she is part of the team. These are part of the team. So these are our funders. So then yeah, I mean, I don't want to make you happy. Now you're happy now. But I had to make these two people here happy first with the report. Then even me, I was quite happy because they were happy, and then me, I was happy later. Then now I can talk about it, with a bit of power and even confidence. So people who were on the way. So I've got this guy here from India. Then I've got this lady from Jordan. Njeri is I mean, here people know Njeri. So Njeri was here at the HRC. Now she's with the African Development Bank, but she was tasked with the first index under the African Union or Service Delivery Index. So she was tasked. So when I got this job, I asked her, what did you do? She said, no, Sam, you just need to take step by step, but you must not bother now with being an HOD, because it will take all your time. So I asked my friend Chirwa there in 2024 to say, I am going to step down. He said, no, Sam, I think you can balance. You were giving me wrong advice. And I knew. Then I said, I think Chirwa thinks that I have that energy to do two things. So I left the HOD and I did very well. I could never have survived because you are looking at you and you are even afraid that maybe there's this guy from Harvard University who would look at your report and for the last 6 months, I've not heard any noise from anybody. I said, okay then. So that's news. Then we have got I think Kandara, people here know Kandara, and the Nada from the MRC. So Nada has a small child. Not now, but last year in August. So I would tell her that from 7 p.m. once you're back from work, you must take care of child. Then she must go to sleep. From 1 o'clock a.m. you must do ABCD, and the Nada would do all those things from 1, 2, 3, 4. a.m. She would do the graphs to compare stuff. She did a lot of work. So things that you will see in the report, those things were done by Nada. Those nice graphs, those paper graphs. Yeah. So it's work. But now in the next phase, Obviously, I'm going to pick some people from here, but these ones are there, the rocks. And then here I will do mix match, pick some people to move with me to phase 2. Yeah. And then phase 2 would go up to maybe 29, because it will take a bit of struggle. So, and that is it. Thank you.
Thank you very much, Professor. Yeah, you went a little bit over time, but that's okay. Yes. So let's thank Professor, and if there's any questions from the audience, we have a break now, so please don't hesitate to ask your questions during the break. Online, thank you very much for joining us. I want to thank Vleroes as well for the opportunity to doing this unique setup, and give the word to Laura for the final remarks.
Thank you, Laila, for giving me the floor. I would just briefly want to thank everyone for attending this community talk. We truly appreciate your attention and participation, both from those who joined in Durban and those who joined online. Special thanks to the speakers, Professor Reddy, Professor Balakrishna, and Professor Manda for sharing your projects, insights, and experiences with us. And of course, thank you again to Laila and Professor Skedi for initiating and organizing this event. For those who want, there is a possibility to continue following the conference. Therefore, please find the link in the chat. There's a small break, but the conference will continue at 3 o'clock Belgian time, 4 o'clock South African time. We wish you all the best of luck with your future endeavor and a fruitful continuation of the conference. And as I said, this session was recorded, so in the coming days, we will share the recording on our website and on our YouTube channel in case you want to rewatch it or share with colleagues. Thank you again. Hope to see you in one of our future community talks, and wishing you all a wonderful day. Goodbye.